Hello aspirants, and a very warm welcome to Rungta IAS Academy. Today, we're bringing you a highly crucial explanator targeting your General Studies Paper 2 Health Syllabus. That's right, sir. We are taking a deep, analytical dive into the architecture of prevention. This is a new healthcare paradigm based on Dr. Prathap C. Reddy's recent insights. Understanding this structural shift is absolutely vital for your mains and interview preparation, so let's get right into it.
Here's our session plan. We'll be briefly covering India's healthcare paradox, the NCD burden, the threat to our demographic dividend, the critical age window, and we'll wrap up with the paradigm of self-stewardship.
Let's start with Section 1, India's healthcare paradox. Now, for the context portion of your mains answer framework, you must highlight a glaring contradiction. You see, over the past 40 years, India has successfully built world-class curative institutions. But Dr. Reddy notes a major fundamental flaw. He says we, as a civilization, have confused the treatment of illness with the pursuit of health. Aspirants, please note this down exactly as it is. This is a golden introductory quote for your essay paper. Using this will show the examiner that you have true philosophical depth regarding our public health infrastructure.
So if a UPSC question asks you to critically differentiate between the two paradigms, remember this. Curative care basically only begins when a patient's health is already broken. It's reactionary.
Precisely, sir. Preventive care, on the other hand, is an act of continuous, deliberate and daily care to protect your health long before any illness strikes. Right now, India clearly has the curative capacity. What we desperately need going forward is a robust culture of prevention.
Moving right along to Section 2, the NCD burden. To effectively address the core issue in your body paragraphs, we really must acknowledge India's epidemiological transition. Non-communicable diseases, things like heart attacks, strokes, and diabetes, have now actually surpassed infectious illnesses in our country. And deploying this exact figure, 270 million Indians currently living with chronic diseases, will definitely fetch you those crucial extra marks in GS2. Tragically, the vast majority of these people are completely unaware of their condition until their body literally begins to fail.
This brings us to Section 3, the threat to our demographic dividend.
Now, if you're writing about the demographic dividend, say in GS Paper 3, you absolutely must connect it to this health data. Preventable illnesses severely diminish the economic contribution of our youth right when they are in their absolute prime. Absolutely, sir. A young democracy like ours simply cannot reach its macroeconomic potential if its workforce keeps losing ground to preventable conditions. And you can solidly back this argument up using excerpts from credible sources like the Apollo Hospital's Health of the Nation report. Remember, data-driven arguments always impress the UPSC evaluator.
Let's look at Section 4 now, the critical age window.
Aspirants, I want you to break these high-yield points down for your running notes. This 30 to 40 years of age bracket, it is the crucial turning point. This is exactly when young professionals are busy building their careers, but it's also the exact time when metabolic and cardiovascular risks silently take hold.
Yes, and the hidden danger here is this dangerous absence of awareness, because these young people don't actively feel unwell, they simply don't seek preventative care. And sadly, by the time the symptoms actually appear by age 40, the opportunity for an early reversal is tragically lost.
Which leads us to our final section, Section 5, the paradigm of self-stewardship.
This brings us perfectly to the conclusion of our mains framework. You see, prevention cannot just be another short-lived government scheme. It genuinely requires a profound, civilizational, philosophical shift. Let's understand this properly. I highly recommend using this golden keyword in the Way Forward section of your subjective answers, self-stewardship. You should define it clearly as a philosophy demanding that managing one's own health is a consequential duty. It requires an active, daily commitment to life rather than just passively waiting for the absence of disease. Ultimately, the legacy our nation leaves behind is measured in the health we pass forward to the next generation. This brilliantly summarizes our entire discussion today. The ambitions we hold for India rest entirely on the strength, vitality, and longevity of its citizens.
Now, before we wrap up this explainer, I want you to consider this mock UPSC personality test question. How does the shift from curative to preventive healthcare impact India's economic ambitions? Take some time to really think about how you would articulate this to the interview board. Keep revising your notes, connect the dots between public health and macroeconomics, and be sure to subscribe to Rungta IAS Academy for more high-yield explainers. Good luck with your preparation, aspirants.